Hi, welcome back to Rohrich Knows Podcast, helping you become a better and more educated you. Today, we're really pleased to have with us Dr. Bita Farrell, who is a anesthesiologist. She's an aesthetic physician. She's also an ultrasound expert. And she, please go follow her on Instagram as well. She talks about safety and how to do it correctly and with ultrasound guidance, which is phenomenal. And today, hey, Bita, welcome. How are you?
Good, thank you. Thanks for that introduction. I'm good, thank you.
Good.
Hope you're doing well.
This is part of a series that we're doing with Bita, and today we're going to talk about hyaluronidase, and many times fillers are injected in areas they shouldn't be, and the biggest area is the tear trough. And the tear trough is a very complicated anatomic area. So I not infrequently, I actually don't inject the tear trough very often. I talk most of my patients out of tear troughs, unless they're young, they have just a small area. But if they have any bulging, any true long tear trough or redundant skin, I think it's a waste of time. I don't know what you do, Bita, but I just think it's a real pitfall area, and that's the area where I actually melt a lot of filler. So tell us about what your thoughts are, but also kind of show us the tear trough and why it's such a complicated area.
Yeah, no, I agree with you 100%. I rarely fill tear troughs. I think there's a very small percentage of people that actually need tear trough filler, and people come in with bags and wrinkles thinking that filler is going to solve it. It actually makes everything worse.
Right. Need surgery.
I also dissolve a lot of tear trough filler in my practice too, and not only if it's too much and making their eyes look more swollen, or if it's just placed more too superficial and it's given that Tyndall effect or that grayish blue discoloration under the skin. So yeah, now with ultrasound we can see filler. When it's become so superficial, obviously you can see it, but it's nice to have an ultrasound. You know, ultrasound makes things that are fluid filled like filler, blood vessels look dark or hypoechoic on the screen, and other structures like muscles and bone, they look more bright or hyperechoic. So that's how you read an ultrasound. You just look at the different, the white, gray, black, and you see the different structures that way. So when it comes to the tear trough filler, I don't have tear trough filler, so I can't show you on myself, but I can show you on myself some cheek filler and what it looks like under ultrasound, and how you can use ultrasound to, actually avoid flooding the area with hyaluronidase and make it more precise and use less product and, and to dissolve it more precisely and get all of that filler out of there.
Okay.
So I'm going to go ahead and turn off the lights so that you guys can see my ultrasound screen better.
Okay.
But I agree with you. I think, filling in like the mid-cheek area in most people is a lot better to support the under eye area versus just filling it.
Right.
Like I said, I don't have tear trough filler, but an ultrasound, when it's placed on the skin, when you look at an ultrasound, the top of the screen is where the...
Can you show it on...
Oh, yes. Yes.
Sorry.
So no, thank you. Thank you for the reminder. So when you look at an ultrasound, you're looking at the very top of it is where the skin is, and at the bottom is the deeper structures. So and like I said, when you see, like for example, this shiny structure here is the bone,
right? Or
the zygoma, and then above it is the muscle, and then it's the skin. And then if you have fat, then you can also see fat in it as well. And each layer has a different composition. It goes from being hypo to hyperechoic. So I'm going to show you on my cheek here, because I do have a little bit of filler in my mid cheek here. So filler on the cheek is typically put on bone, right? Right. And this filler was put quite a while ago, but I can show you. It's been a while, so it's integrated. But if I show you, there it is. I can see a little bit of it.
Yes.
There it is. So if you look over here, you can see there's the bone, and then there's a little bit of this black, and it's not a blood vessel, because blood vessels can look like that, but you see that little thin layer of like a dark area?
Yes.
That is what filler looks like under ultrasound.
It's dark.
Yeah, there's a pocket of it right there.
Okay.
I don't know if you can see it,
Yes,
Rod.
yes, I can see it. I can see it very well. And then the radiolucency above that is what? Is that fat?
Yes, it's a little fat, and actually, this is a muscle. This is the zygomaticus muscle.
Oh, yeah,
so
yeah.
This is the bone, the little filler, and this is the muscle.
Right.
And then the fat would be just under the skin, and then it would be skin.
That's great.
And like I said, my filler it's been a long time since I had filler, but that's what filler looks like on an
great.
ultrasound. And again, cheek filler is, you typically place deeper, but when it comes to filler under the eyes, it's very superficial, so you would see it. I don't have it, but if you were to look at it, it would be at the very top of the screen. And it's great to see lip filler migration too. Again, you could put the ultrasound on above the vermilion border and find the filler that's spilled above it or migrated to help you dissolve it very precisely. Again, you could also do it without ultrasound and just flood the area with a lot of Hylenex or hyaluronidase, but I find that kind of dehydrates the tissue for a few days, so I like to use less product if I can.
So just like with filler, you put the hyaluronidase in under ultrasound, and you can just shape it.
Yeah. So I use a cannula, very, very thin cannula, like a 25 gauge or a 27 gauge, so I can really precisely get into these pockets and deposit the Hylenex in there.
That's great. That's awesome.
So,
That's awesome. Yeah, no, I agree.
And in the case of a vascular occlusion emergency, then this becomes very handy. Then you can really quickly locate where the filler is, and even with the Doppler flow function on the ultrasound, you can see where there's a blockage of the Doppler flow and see exactly where the blockage is with the filler, and really then flood that area with the hyaluronidase.
Right.
In the case of an emergency, it becomes very useful too.
Right. No, I agree. I mean, the more precise you can be. I mean, obviously before it was this shotgun approach, you just injected. But if you have ultrasound, you can precisely put it where the vessel occlusion is. And there's some studies that I've seen with that. So that's fantastic. So in wrapping up, tell us about what are the most important safety points that you can leave our viewer with on the use of ultrasound, but also just obviously knowing the anatomy, using needles versus cannulas, and just slow is better, less volume, don't do crazy stuff. So for newer injectors, number one, if you're going to start with a filler, use a hyaluronic acid filler that is dissolvable. Don't start using something like Radius, which is not dissolvable, not easily dissolvable or reversible. So if you're starting off, use something that's easily dissolvable, like a hyaluronic acid dermal filler. And yes, always practice less is more. Like, really, I mean, not just for safety, but also for aesthetics. We want this field to remain reputable and not be known for making people look like cartoon characters. It's about replacing lost volume and enhancing someone's feature, not just filling and making somebody look like a pillow. So minimize what you should use less. And a cannula is wonderful. It's very, very, very unlikely for a 23 gauge cannula or even a 25 gauge cannula to act like a needle and puncture an artery. In addition, it causes less bruising and less trauma to the tissue, because a needle is sharp and it goes through tissue like, a hot knife through butter. Whereas a cannula is very, 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 very polite and gentle, and it won't even puncture the skin. You need a needle to puncture the skin to put it through. So it's a very safe thing to start with. And always have your insurance. Always have a bunch of Hylenex in the fridge ready to go. Yep, no, I agree. Now, obviously, I use more needles and cannulas, and I think the key is everything's proximal to the needle or the cannula. It's the injector. And so, just be safe, don't do crazy stuff. And I agree, less is more. We're in the face protection, not witness protection program. We don't want to make people look like cartoon characters, and we see so many of those. I see a lot of them, and I'm sure you see a lot in LA too, and it's just appalling to me. It makes me very sad because I look at their pre-op photos and I look at what they come in with, and it makes me very sad because it could have been avoided. So know before you go, find an incredible filler injector like Dr. Farrell if you're in LA. She rocks. So thanks again for your sage advice, your excellent demonstrations. I really appreciate all you've done, and for giving back and teaching us a lot about ultrasound and safety. So thanks again.
Thank you so much.
You bet. And if you have any comments or questions, please direct them towards me. And till next time, stay safe.